I'm performing hand hygiene as they're walking in. Previously cleaned my stethoscope. Hi, my name is Wayne. I'm a nursing student. I'll be doing a head to toe assessment on you today, okay? Can you please tell me your full name and your date of birth?
Pamela T. Andrews, February 21st, 1953.
Okie dokie, and that makes you how old?
68.
68, okay. Are you in any pain right now, Pam?
No, I'm not.
Alrighty, if patient were in pain, I would use the old CARTS method to assess her pain further and use a scale of 0 to 10, 0 being no pain, 10 being the worst pain imaginable. Do you have any allergies, Pam?
No, I don't.
No, nothing, no food, to medication, to the environment? Okie dokie. Can you tell me your weight and your height?
5'3", 149 pounds.
Okie dokie. Based on this, patient has a normal BMI. I am going to continue with my general survey. Patient doesn't appear to be in any acute distress. There are no obvious physical deformities. Patient's head is midline. This patient's skin is pink. There is no cyanosis of the lips. Patient is well nourished, well groomed. She appears to take good care of herself. There is no obvious odors. When the patient walked in, I observed her gait. There are no abnormalities. When she's talking to me, I don't notice any slurred speech. Also, patient doesn't have any nonverbal pain markers. She is calm. She doesn't appear agitated. I'm going to continue on my assessment with the patient's head. I want to start with her hair. It appears to be evenly distributed. I don't see any significant hair loss. Do you have any problems with hair loss?
No, I don't.
Okie dokie. It is of good quality. It appears healthy. It is not dry or greasy. I don't see any lesions or skin flakes when I'm looking around her head. Okie dokie. Looking at the patient's face, it is symmetrical. There are no obvious deformities. There is no bleeding, no bruising, no discoloration, signs of trauma. Can you go ahead and give me a big smile? Show me your teeth, big, big smile. All right, and close your eyes real tight and open them up real wide. Okie dokie, there's no facial droop. I'm gonna shine a light in your eyes, okay?
Okay.
So just go ahead and look at the wall here for me. On this side. Pupils are 3 to 2 bilaterally. Looking at the patient's eyes, they're green. Eyelashes and eyebrows are present bilaterally. They're symmetrical. There's no drooping of the eyelid. There's no bruising around the eyes. Patient's pupils are equal, round, reactive to light, and accommodating. Next, I'm going to look at the patient's ears. Do you have any hearing problems?
No.
Okie dokie. Patient's ears are aligned. They are proportional to her head. Looking at the left ear, I don't see any bleeding, bruising, or discoloration. No lesions, no drainage. She has one piercing on the left side. I'm going to look at your right ear. There's no lesions, no drainage, no signs of trauma. One piercing on the right side. Ears are symmetrical. Now we're going to move on to your nose. Nose is midline. It is symmetrical. Doesn't appear to be deviated to either side. There's no bruising or no bleeding, no drainage, no lesions. Can you go ahead and put one finger on one side of your nose and breathe in and out? Same thing on the other side. Breathe okay on each side?
Yes.
Okay. Lean back for me and look inside your nose. I don't see any drainage, no bleeding, no lesions. Okie dokie. I'm going to go on to the patient's mouth. Patient's lips are not cyanotic. They are pink. They cracks. They're dry. I don't see any swelling. Go ahead and open up your mouth for me. Okay, looking at the mucosa, it is pink. There's no swelling. There are no lesions. I don't see any bleeding. There's no missing teeth, no cracked teeth. Okie dokie, stick your tongue out for me. Patient's tongue is not discolored. Okay, stick that tongue out and say ah for me. One more time for me. Alrighty, when the patient says ah, the soft palate moves upward. Patient's uvula is midline. There is no swelling and no redness. Okay. Next, I'm going to look at the patient's neck. I don't see any JVD. Bilaterally, there is no tracheal deviation. We're going to just check the range of motion of your neck. So all the way to the right for me, all the way to the left, all the way back, all the way down. Then try to touch your ear to your shoulder. Same thing on the other side. Any pain when you're doing that?
No.
Okie dokie. Next, we are going to do the patient's upper extremities. So you have any pain in your arms, in the joints of your arms? Okie dokie. I'm going to feel the patient's arms. They're warm, they're dry, no diaphoresis. They're pink. Cool, relax these, okay? I'm going to feel your arms. You tell me if you feel any pain, okay? Any pain in these joints? No? Okie dokie. I noticed some macules, which are primary lesions. I will note in my documentation. We'll look at the patient's hands. Patient's nails are rounded and smooth. There's no pitting, no ridges. Assessing capillary refill. It is less than 3 seconds on each side. Okie. I'm going to feel for your pulses here at the same time. Patient's radios are 2+ and regular bilaterally. Okie dokie. I'm going to assess your range of motion. So move your arms like this for me. Spin your wrist around, inwards, outwards. Move your fingers. Okie dokie. Any pain when you're moving around like that? Patient has good range of motion. Go ahead and squeeze my hands. Real tight. Real tight, real tight, real tight. Okie dokie. Put your arms up like this. Pull towards you. Push away from you. Okie dokie. Patient has good strength. I don't notice any weakness on either side. Next, we are going to move on to your respiratory system. I don't notice any acute distress when the patient is breathing. Are you having a hard time breathing at all?
No.
Do you have any lung problems? No?
No.
Okie dokie. I look at the patient's chest. I see symmetrical chest rise and fall. I don't see any accessory muscle use, no retractions, no bleeding, no bruising, no discoloration, no paradoxical movement. I'm going to listen to your lungs.
Yeah.
Okay. 6 spots in front, 6 spots in back, 2 on the sides. First spot here, I'm going to be listening to bronchovesicular sounds. So take some big deep breaths for me, okay? And you let me know if you need a break. Next 4 spots are going to be vesicular sounds. Okie dokie, and then we're going to listen mid-axillary on each side. So lift your arm up for me. This is going to be vesicular on each side. Okay, same thing on this side. Okie dokie. I'm going to lift your shirt up and back. Take a listen. First two sounds are going to be bronchovesicular. Next four are going to be vesicular. I'm not sure if I misspoke earlier, but those first two were bronchovesicular sounds. Next four were vesicular sounds. Lung sounds were clear bilaterally. There were no crackles, there were no wheezes, there were no bronchi. Okie dokie, you doing okay? All right, next part is going to be the cardiovascular system. First, I'm going to start out with feeling your carotid pulses on each side, not at the same time, okay? Feel on this side. Okie, carotids are 2+ and regular bilaterally. I'm going to listen to your heart next, okay? So it's going to be 5 spots on your chest. One here on this side, and going on the left side around your breast, okay? So you can relax and lean back. Okie dokie, first one is going to be on the right sternal border, second intercostal space. This will be the aortic valve I'm listening to. I'm going to listen with both the bell and the diaphragm of my stethoscope. I hear S1 and S2. No murmur. Next, we're going to move to the left sternal border, second intercostal space. Listen to the pulmonic valve. I hear S1 and S2. No murmurs. We're going to move down to the third intercostal space. This is going to be Erb's point. I hear S1 and S2, no murmur. Fourth intercostal space on the left sternal border. This is the tricuspid. I hear S1 and S2, no murmur. Last one is going to be midclavicular on the left side, fifth intercostal space, where I'm going to listen to the mitral valve. I would listen for a full minute here, time permitting. Okie dokie. S1 and S2 are present, no murmurs. You don't have any heart problems?
No.
Okie dokie. Next, we're going to do a GI assessment. Do you have any nausea, vomiting, diarrhea right now?
No, don't.
Any GI problems, any stomach problems? Okie dokie. When's the last time you urinated?
About an hour ago.
Okie dokie. And when's the last time you had a bowel movement?
Last night.
Okie dokie. When's the last time you had something to eat?
About half hour ago.
Okie. So I'm going to lift up the patient's shirt, respecting her privacy. I'm going to take a look at the abdomen. It is rounded. There's no bleeding, no bruising, no discoloration. It's symmetrical. I don't see any scars from a C-section. No colon sign. Okie dokie. I'm going to take a listen using the diaphragm of my stethoscope. Listen to your bowel sounds, okay? Starting in the right lower quadrant. Okie dokie. I'm going to lean you back here so I can feel around your tummy, okay?
Okay.
So hope you lean back. Alrighty. You said you're not having any pain right now in your stomach?
Right.
Okie dokie. I'm going to feel around, starting in the right lower quadrant. You let me know if you're feeling any pain when I'm touching you, okay?
Okay.
Alrighty, nothing hurts?
Nope.
Okie dokie, so we have no distension, no tenderness, no guarding, no pulsating masses. Okie dokie, I'm going to sit you back up here. Ready? And we're going to do an assessment of your lower extremities now. Okay?
Okay.
So keep your legs down. Do you have any pain in your joints? Do you have any
No.
difficulty moving around, getting up and down stairs?
No.
No? Okay. I'm just going to slide these up a little bit. Inspecting the patient's skin. See some vascular lesions. We have venous stars present bilaterally. No bleeding, no bruising, no discoloration. No obvious signs of trauma. Patient's legs are warm, they're dry. No diaphoresis. Alright, I'm going to feel your legs okay. You let me know if you have any pain anywhere, okay? Any pain in the knees?
No. No.
Down to your ankles?
No.
Okie dokie. I'm going to assess the range of motion, so go ahead and stick your knees straight out for me. Okay, back down. Pull your ankles around. Point them inwards. Point them outwards. Wiggle your toes. Okie dokie. Go ahead and push against my arms. Same thing the other way. Alrighty. And then push your feet down like you're pushing the gas and the brake at the same time. Okay, and toes toward your nose. Alrighty. Patient has good range of motion. I don't notice any weakness on either side. I am going to assess for some pedal pulses. Relax your legs. And pedal pulses are 2+ and regular bilaterally. Alrighty. That concludes our assessment today. Do you have any questions for me before I get out of here? Is there anything I can do for you?
No, there isn't. Thank you.
Okie dokie, I want to make sure that the bed is down on the floor, or the lowest position, side rails are up, call light is within reach, and I'm going to perform hand hygiene as I leave.